Good afternoon, everybody. I'm hoping you're enjoying your wonderful food. We're going to begin the program shortly. I wanted to welcome you all to the 24th Annual Graduate Research Conference. My name is Stephen Pernicke, and as of 7 months ago, I took the position of Associate Vice Provost and Vice President of Grad Studies and Research, and I've been having a wonderful time. This is a culmination today of a lot of the work that you've done with your students, faculty, and the students' presentations today have been outstanding. There is so much talent in this room. Before I go any further, though, I'd like to have President Smith come up and maybe say a few words, as long as he's done with his cheesecake. So.
First, I chose cheesecake because it was the only reasonably sized dessert that was back there. I saw several of you dissecting the cake, and I think you could make those into quads and still have a nice dessert. But we were saying at our table, we've been to many conferences when a dry cookie is the dessert, so this is kind of a nice add-on to see that. I want to welcome all of you. I know that a number of you have heard this before, but I'm going to reiterate that it is great to see you in 3D again. Many of you I have seen during the course of the last 2.5 years on an iPad screen, and it's lovely to see you in full display. It's great to hear conversation as we're in the food line talking about our research interests, our teaching interests, what's going on. I heard chatter about things going on in people's families, and you miss that when you're not together. And again, I'm very pleased to see everyone. I would also say that Steve's comment on the research that's going on, the collaborative research with our students, really does make a difference in the life of a university. And obviously I'm preaching to the choir here because all of you are doing it, but it's not always the case everywhere in an academic institution where we have faculty willing to be elbow to elbow with their students doing really high-end research and really exploring the boundaries of thought, whether it be in a discipline that's relatively common to one where it's relatively uncommon. So I want to thank you for that. And the last thing I would say is that let's don't lose these moments. Take the opportunity at your table. Hopefully there's a person or two at your table that you don't know. Take the moment to talk about what makes you excited about the work you do. Sometimes we come to these and we talk to the person to the right or left of us because they're the people we know, and we lose the moment to talk to the person across the table or maybe the table behind you. And take that opportunity because it is the richness of sharing that really makes these experiences what I think are transformational for a university. If all of us just spoke to the folks that we have lab space with or that we have classroom space with, think about how boring the world would be, particularly in my discipline. Who really wants to hear me talk about educational policy? Only my other policy friends. So it's nice to be able to talk across that table and share what you're working on, what you're thinking about, what your students are working on, and what they're thinking about. Thank you very much. Enjoy that huge dessert.
Thank you, sir. Thank you, President Smith. We'll take your words to heart for sure. So, as you may have noticed in this morning's sessions, we are celebrating research that emphasizes diversity, equity, and inclusion, which is of emerging importance and fundamental to our work as our university moves into the future. Now, with a word about diversity, equity, and inclusion, please help me welcome the President and Vice President of the student group, Psychologist of Color, Cynthia Thomas and Daniel Like. Come up.
Hello, everyone. My name is Daniel Like, and I'm the Vice President of the Psychologists of Color Graduate Student Organization. I'm a second year in the clinical psychology doctoral program. We are hosting the symposium related to diversity, equity, and inclusion today. So we've had 2 rooms available throughout the day that has housed the different presentations related to diversity, equity, and inclusion. Cynthia, can you introduce yourself?
I never remember how short I am until I get to a podium, but my name is Cynthia Thomas. I am a second year doctoral student in the clinical psychology program, and I'm also the president of SciOC. So I'm so grateful to be here and so happy to have y'all here with me.
Yeah, so I'll talk a little bit about the goals of the symposium as well as some of the work we do at SciOC. So we are a graduate student organization housed in the psychology department, and we're dedicated to providing a safe space for psychologists of color and allies to have conversations that are open, safe, accepting, as well as to provide events related to diversity, equity, and inclusion. So we've done a number of trainings. We've done trainings related to implicit bias. We've done social events. Some of those include like supporting local Black-owned businesses, attending local events related to DEI, going to different museums and having conversations. We really value having a space to have conversations that we're not always able to have in our day-to-day lives. And as busy graduate students, we're learning so much. We want to be able to provide that space, to the people in our program to have those conversations related to DEI. And so with that, we thought we wanted to organize a research symposium related to DEI with the goal of highlighting research in this area across the different graduate programs here at EMU in a multidisciplinary effort. So we wanted to bring together the graduate community to create sort of connections, to bring together people who are passionate about DEI and care about making a difference in this area. And another goal was to really bring attention and awareness to the research being conducted in this area at EMU. Historically, research in this area has been underrepresented in higher academia. And so we really wanted to bring awareness to, what is being done at EMU in the graduate program. When we were coming up with the idea to do this event and developing it, we initially thought, maybe the turnout might be like sort of a small, intimate group. Maybe we would have one room that would sort of run throughout the day, and maybe we'd get between 5 and 7 people, but we were so pleasantly surprised to have over 20 people presenting their research related to diversity, equity, and inclusion today. And so we just want to say we really value everyone's contributions. I've really enjoyed the presentations that I've attended today, and I think it just shows that, we have so many people here that are passionate about this work and making a difference. So I'm looking forward to seeing everyone's presentations for the rest of the day, and I'll hand it off to Cynthia.
Thank you, Daniel. And I just want to reiterate everything that Daniel said. We are so grateful that you all decided to participate in this. This has been a passion project for SciOC. We've been so excited that so many people were interested in this. And of course, we all know that diversity, equity, and inclusion can't be confined to 1 minute of a talk. But what I will say is that historically, research has not represented people of color as it should. And that's speaking from both the participants, the people who are included in samples, as well as the people who are conducting the research. So typically people of color were not the people who were designing these projects and pushing these things forward, right? But we know that science benefits from having diversity included, whether that is from the people who are designing the studies to the people who are participating. And if we don't include diverse populations in our studies, then we are going to live in a world where we only understand phenomena from one cultural lens. And understanding it from one cultural lens very well is good, but not when it is our only understanding. So we want to make sure that we are including diverse samples and including and uplifting and empowering people from diverse populations to be in the scientific process at both ends of the spectrum. So with that being said, We're so grateful that you decided to be here today. We're grateful for the people who are presenting, but also the people who wanted to come and see science be conducted when DEI is one of the main tenets that it's operating off of. So we're grateful for you. We value the work that you're doing. I know the world will value the work that you're doing, and we encourage you to continue to work in this space. Thank you guys so much. Or you people, you folks. Inclusivity, baby.
Thank you so much, Cynthia and Daniel. And I want to kick this off by saying that in this year, we welcome 95 presenters, quite a good number, and 67 faculty sponsors from all colleges across Eastern Michigan University. And to those who have presented this morning, congratulations, and you can relax now. To those who will present this afternoon, best of luck, and we're looking forward to your presentations. So now, all of the research work our graduate students do at EMU has the ability to change our view of the world, if not the world itself. And from what we've seen in today's presentations so far, there is no doubt that you all have a very bright future ahead of you. I want to thank first the GRC team as we move through a bunch of thank yous. We have a great graduate research conference committee, and I'd like them to stand up if they can so we can recognize them. They're probably busy, so you're not going to see them all that much, but I'll name them anyway. Sonia Chawla. Is Sonia here? She's upstairs already? Okay. Jenny Kindred. I thought I saw her here. Thank you. And Janet LaPalla. We also have a wonderful staff at the office, and a few of them have been here throughout the day and in our other festivities that we've had yesterday. Tracy Pitlick. Phyllis Britton is back at the office, and probably Gabby is elsewhere today as well. But Gabby Heyer, also at the graduate school, our graduate assistant, the other graduate assistant. We also like to thank student group Psychologists of Color for coming and speaking to us today. And I also want to recognize the work of our Office of Research, Development, and Administration. They have been here throughout the day as staff to help us and actually have provided some excellent questions for some of our speakers as I've sat in some of the presentations. So thank you all for participating and helping with staffing this event. Also, the faculty from EMU and staff that volunteered to be moderators of these sessions today, we thank you so very much for your time and effort and ability to facilitate the discussion. Now, I will have some individual mentions, and I'll bring these to your attention because of some exhausting work they must have done. There have been faculty who have gone above and beyond to get student presentations here today. I would mention two individuals each of whom has 7 students presenting today. Joe Bishop from College of Education, and Mary Elizabeth Murphy. So I thank you for your individual efforts, and boy, will you have a good rest after we're all done. I also want to mention a couple of programs, departments, schools that have done a wonderful job in the number of student presentations they have here today. The History Department has 10 students presenting here today, and Orthotics and Prosthetics, a total of 12. So thank you all for all your efforts in your programs. Without all of these individuals, and thank you to you all, none of this would have been made possible or happen. We also want to additionally thank the catering staff and Meg Castro for making this wonderful lunch a great experience and for making the helpings and the dessert very large. Today, the graduate school is delighted to welcome this year's keynote speaker, Frank Urban. Mr. Urban is the Director of Venture Creation for Michigan State University's Spartan Innovations. In his role, he assists startup companies within the life sciences in areas such as early-stage therapeutics, diagnostics, and medical devices. Mr. Urban has held business development, sales, and scientific positions at many different companies. He worked as a licensing associate at Wayne State University. He has assisted many startup companies as a consultant and has been a manager for various laboratories at the University of Michigan. Frank holds a Master of Science degree in molecular biology and a certificate in business administration from Eastern Michigan University. He says that his experience at EMU was extremely positive, and the education that I received here shaped my career. Let's give a warm welcome to Frank Urban.
Well, hello, everyone. And I'll do like my wife said and raise this mic up a little bit if I can. There we go. Hopefully you can all hear me. So I started coming back to, or came to Eastern Michigan back in the 1900s. So that's how long I've been around. So I did my undergrad at Concordia, but every spring, summer, as I was telling someone earlier, I would do all my courses here at Eastern because they didn't do them at Concordia, and really enjoyed the school. And that's why when I was working at U of M, had the chance to either go to University of Michigan or to come here. I came here for my graduate school. Worked in molecular biology, and it's there that I presented here 20 years ago at this symposium. So glad to be back and do full circle here. And I got to admit, I'm over at MSU now and working for the MSU Research Foundation in my group Spartan Innovations, but I'm still green and white, literally. So thank you. But I wanted to start you down the journey because now you've been doing the research and you're finding out, okay, how things work, how things operate. You're looking into new mechanisms, things that people don't know even existed sometimes before, or new ways to use those mechanisms and how they work. And that's what research really is. We're inquisitive. We go and we say, I think this is how it works. I test it and I prove that it does work, and then I go back and test it again and again and again. That's what we do. But how do you get that research out to people? How do we get it? How do we get, as an example, a drug? If I find a new target, how do I create a molecule to that target to, for instance, inhibit that target, and then take that molecule all the way to where we can get it to patients at the bedside? So that's kind of what I want to talk about today, is a little bit beyond the research and saying, how do we take that research now and how do we turn that into something that people can actually use from what we've done? So, and the clicker works. So my journey from here at East, there we go. My journey has taken about 25 years, and I've switched positions, sometimes within companies or outside companies or laboratories, about 12 times in the last 25 years. And I won't highlight everything in here, but I started out at Park Davis and Pfizer, and I thought, well, great, this is where I'm going to stay. This is what I'm going to do. I'll be here for 20 years, then I can retire and do whatever else. And then 2 years later, it's like, Park Davis is not going to be here anymore, and Pfizer, who took them over, decided that we're not going to be here anymore. So the thought of me staying there for 20 or 30 years kind of went out the window in just 2 years. So I had to pivot my whole train of thinking. Fortunately, I was able to get into the University of Michigan, and I worked in a couple of labs there. And we were working on taking T cells and changing the genetics of T cells, the T cell receptor, to target breast cancer, HER2/neu. And some of you might have heard of CAR T cells or chimeric antigen receptor T cells. Well, we were working on a precursor of that all the way back, starting in the early 2000s, we were doing that work. And we're actually competing with the group that was making CAR T cells that are known today. Unfortunately, there was an incident that happened over in France where they were doing immunoadoptive therapies. 4 children got leukemia, and the NIH cut funding basically to a lot of immunoadoptive therapy research, so we dropped the entire project. And if we didn't drop that project, we might have something that's actually in clinic today. But that's what I presented on at this conference 20 years ago. So when people hear about CAR T therapy and the different things that were happening, EMU was actually part of that. Even though a lot of that research was done at the University of Michigan, we did a lot of that research here as well. We used the electron microscopy that was here. We used some of the confocal microscopy that was here. So a lot of my research was there, but it was also here. So I think that's just a pretty interesting story. So I flipped around to a bunch of different groups, and then probably about halfway through my career, I switched over from doing science to doing more business development and being more on the industry side of research, trying to sell scientific products. So at some point, they put a red line in the lab and said, please don't cross this anymore. You're only going to screw our experiments up. And so I started doing more theoretical science kind of on the sales side. So I went through a couple of different industries, and I worked at startups, a number of startups. And the thing with startups is you do everything. Everything is up to you. And you have to do the science. You've got to unclog the toilets. You got to clean the trash. If something goes down, you got to work on it because you don't have money. I'm talking to professors that probably know exactly what I'm talking about. But you don't have money, you don't have resources, and you got to use whatever resources you have to get the job done. That's what we do as we bootstrap. So after doing that a number of times, when I was back at Park Davis and Pfizer in big industry where we're so big, they said, you do this one thing and you do it well. That's all you're going to do. And, you know, basically for most of my earlier career, I was in the rat and mouse rooms. And so we were talking about COVID where you can't talk to anybody. Well, I started talking to the mice and rats. What really was interesting is when they started talking back to me. That's when I knew there was an issue. And that's kind of when I left. So, but, you know, but being in that small startup business and doing everything, you learn everything. You know what everybody else is doing. You participate in every part of the research, and you know it from front to back. And when you're in large pharma or large industry, you don't really get that notice. And so that's where startups come in, and you can really learn a lot, and it's a really powerful place to be. So I'm going to be talking about taking that translational event to technology. And there's two different types of people that we see. So I always think of it as you have the biomedical people and you have the engineers. Biomedical people say, I'm working on cancer, I want to go after triple negative breast cancer, I'm going after this target, this is what I'm doing, and if I can get this, you know, to do this in the animal models, and I can get this to do it in clinic, I know what my market is and I'm going to go. So they're already market focused, but then you go on the engineering side, and the engineers are like, this is really cool, where can I use it? You know, I don't know what the market is, all I know is I got something cool. So Tesla is an example. When he was working with magnets and he was working with coils, and he was saying, well, you know, I can move this coil over this magnet, have that coil go here to another coil over a magnet, I move it here and it moves over here. And he showed that to, the Society of Science back then, basically a motor and a generator. And they said, well, that's really cool. What can you do with it? He goes, I don't know, but someday you're going to be able to tax it. And he was right. We found uses for it. So there's all different approaches to technology and taking technology to market depending on where your position is. But that's kind of what I want to highlight today. And when you look at where universities fit, and you say, well, what do universities do? They suck up a lot of money, they teach a lot of students, and what else? What do they give back? Well, the Association for the University of Tech Managers, Autumn, recently put out that universities in this country put out 1,000 technical startups a year. These are not bakeries, these are not, car sales and all that, and that's good stuff to have, but when it comes to technical startups, 1,000 startups per year. That's a force among itself, and here in Michigan, over 40% of our jobs are small businesses. So how strong is that to our own economy? So just think of that going forward. When we look about economic development and job growth, in 1996, there was a big shift to not just do basic research at universities, but try to translate that research to something, and working with companies and corporate partnerships to do that. And since that happened in 1996, $1.7 trillion has been generated and 5.9 million jobs, all because of the research that happens at universities. So if you think about that, that's really powerful. And so what you guys are doing here in the research that you're doing, you might say, well, I'm just looking at this small little thing right here in this small picture. But that small picture could really turn into something big. And that's where we see a lot of the innovations at. So I just want to encourage everybody as we go through this to think about your projects, your research, your career, and what you want to do. And can you take what you're working on now and translate it into something larger? So even if you look at the NIH, the NSF, a number of these basic science grants, you'll see that a lot of them are starting to shift their potential too. It used to be you can do great research, you go ahead, you apply for an R01, an R21, R5, P1, whatever have you, and you could just keep going on research. But now you see like the NSF and now the NIH and a couple of others are starting to shift where they're like, no, we want to see a translation happen. We don't want you to just do basic research. We want that to go to market at some point. We want it to help people, and we also want it to stimulate our economy. Both can happen at once. So NSF came out with these things called broader impacts, where if you're getting an NSF grant, even at the earliest stages, you've got to go through and you've got to say, what am I going to do for inclusion, STEM, public engagement, societal well-being, the STEM workforce, partnerships, infrastructure, economic competitiveness, and even national security. And I kind of blued out those boxes, and those are areas where we work with faculty all over the university, over at MSU, to help them with their broad engagements and their broad impacts, and say, this is where we can help. And they can say, well, yes, if we do this, this is who we're going to work with. We'll work with Spartan Innovations. Here's how we'll move the technology forward. And then they can move forward with their grants. But even further, if you look at the TIP directorate that's came out of the NSF, they said also, we want translation, technology, innovation, and partnerships to come out of the research that you do in STEM. So when you're going for that basic grant, you're going to see TIP become more and more prevalent, that you're going to have to come up with a strategy. When you say, I'm going after this receptor, I want to see what it does, you're going to have to put in there and say, if it does what I think it does, this is how I'm going to go ahead and move it forward. So you've got to now project out thinking that we haven't had to do before, but now all of these big institutions that provide grants and contracts are now asking for that and starting to ask that. It's only going to get, I'll say, worse as we go forward. But if you think about it, this is coming from taxpayers. And taxpayers want to see us move in research, but we also want to see cures for diseases. We also want to see societal problems get changed and everything else. It's no good if you just do your research, publish on it, and move on to the next thing. How can you take that information and then change it to transform somebody else's life? That's really what we're looking for, and that's the whole point of why we're here. So I got an idea. What do I do with that? There's a number of things I can do. I can do research. Maybe I can do a license to a company that's already out there. And in some cases, you can do a startup. The biggest myth we have and the biggest problem we have, and I can give you a couple of anecdotes on this, is everybody goes, if I build it, it will be so cool. Everybody will want to fund this and take this forward and move it to market. I've seen that once in my lifetime where that's happened, where actually somebody had a really cool technology and people kind of swept in and helped to move it forward. Everybody else really had to work at it. So this idea, if I build it and I have good data, they'll come, doesn't really exist in most people's lifetimes. Again, it does happen rarely, but extremely rarely. Just like being a billionaire. I think I can do it, but I haven't done it yet. So I'm working on it. And then, we're in science, and we're talking about science today, but there's business that's behind it too. So you can't just think as a scientist anymore. So if you see a faculty member and they're funded by a federal agency and they're doing research, and they say, I'm a scientist, no, you're a grant writer. Basically, that's what you are. You write grants, and they have to be really good at that. If you're an entrepreneur, you've got to know your science, but you've got to know your business, and we're going to go over some really briefly some aspects on it. And you've got to be the end-all, be-all of everything. And that's what you're challenged to do nowadays, is to not just know the science, but know how can I translate that science and what can I do behind it. And if you look at the reasons why companies fail, and these are the top reasons right here by CB Insights. If you look at the NSF, they came out with basically the same solutions. There's only 2 in here that are possibly even involving the science. One could be you got out-competed, which means there might be a better product than yours, which means, okay, yeah, that might go back to my science. And then you see way down the list over here, poor product. Everything else on this list is business related. So you not only have to be scientists, you also have to be business people and be business smart too, because if your company is going to fail, chances are it's got nothing to do with the science and the research that you're doing. It's got everything to do with people. It's got everything to do with management. It's got everything to do with how do I move my product and how do I sell myself? How do I sell my company? How do I sell my people, my team? It's all about that. So we've got, when I went to school, and I know this is old-fashioned, we used to get, these titles of like manager and director. What are you managing? What are you directing? Are you directing the science, or are you directing the people that are doing the science? Really, it's all about people management and how do you manage your teams. And if you look at this list, it'll show you that most of the problems here are team dynamics. It has nothing to do with the science at all. So what do we need to do to translate something? How do we get something to market? I always think of the plan, the people, and the funding. Those are the 3 things that you have to have. And if you don't have one of those, there's no way you're going to make it. So you've got to have a plan. How am I going to get there? What am I going to do? The first thing you do when you sit and do research, you think of, what's my hypotheses? What am I thinking of? What am I going to test? How am I going to get out there and do it? That's your plan. Build that out first. Then you want to get people in there. Can you get people that have done it before that can guide you? in the way? Can you bring people in that know what they're doing on the business side and mix their business skills with your scientific skills and cross those together to come up with something that's going to work? And then, of course, the funding part of it is always what people say is the hardest part of it. Personally, I think that the funding is hard, but I don't really think it's any harder than the people or the planning part, to be honest with you. Because if you plan poorly, you're going to execute poorly. So let's talk about the ideation. How do I get an idea? And so you'll see here one of the biggest things now in business is this whole design thinking process. And people look at this and go, wow, this is awesome, this is great. We can empathize with people, we can look and we can see what the problem is, we can define it, we can ideate it, we can prototype it, we can test it. Kind of sounds like that scientific method thing we learned in the first biology class or science class we ever taken. And yet people are looking at the design thinking process going, this is revolutionary. Well, scientists have been thinking this way for well over 100 years. It's nothing new to the science field, but now the business field is kind of catching up to what the scientists are doing. So is there a lot of difference between business and science? Probably not as much as we think. So when you think of it just like the scientific process. Let me ask my questions. Let me figure out what research I have to do. What's been done in the area and where are the gaps and what's missing? And then I can say, well, I think this. And then we build out our hypothesis, and then we have to test that hypothesis out. And then once we test it, we look at our results and say, does my hypothesis pan out, or do I have to go back and do more research? And anybody in science knows when I first started in an undergrad, I'm like, well, gosh, most of the science is probably already done. But then I realized with every question I answer, I get 3 or 4 more that I have no idea on what the answer is to that. And then you look at those 3 or 4 questions, and you end up with 12 or 15 questions. And then you go, man, we don't have enough manpower or people doing science in this world. Because we still haven't figured it out. So you also have to have the right perspective. So in World War II, this is I heard this at a talk, this is nothing I came up with, but I thought it was just incredible, is that in World War II they were looking at planes, and they said a plane can take a certain load, and when the Germans were shooting at our planes, we wanted to see where are they hitting them and where are they causing problems. So when the planes came back, they would actually map out where the bullets hit, and they said, that's where we need to put the armor because that's where these planes are getting shot at. So they put the armor on. The problem was they were looking at the planes that survived. Where the bullets are missing, those are the ones that didn't survive and crash. So what happened with their hypothesis when they tested it? We're putting the armor in all the wrong places, and we're actually helping them shoot us down because we're weighing down our aircraft. They're not as fast. They're easier to hit, and the places that they want to hit are wide open. So that's one example of kind of looking at it from the wrong perspective, but why you have to test things. And I hate it when people come to me and say, well, theoretically it should work. Okay, yeah, I heard that many, many times. Try and do that on a grant. There's also the idea of cause and effect. So for so many years when I was we were looking at beta amyloid plaques and neurodegeneration and neurodegenerative diseases. And we were saying, we got to really attack this beta amyloid because when you look at all these disease patients, they all have this beta amyloid plaque. Well, all of our research was focused on that, and we attacked it and attacked it and attacked it, and finally, we knocked that beta amyloid plaque down to almost nothing. Guess what? Didn't do anything to the disease. Disease was still progressing. The people were still symptomatic. They were still having all their problems. The thing was, it was an effect of the disease because something else was causing it, and that was the effect. We knocked down the effect. We never hit the cause. So we got to make sure that we're hitting the cause, and we know what that cause is versus the effect that we're seeing. And a lot of science has been balked like that. PSA, prostate serum antigen, was the same way. They checked it with biomarkers. We can knock down PSA. Prostate cancer still killing people. So, perfect example, I heard the DEI that came up here, and this is no different when you're translating technologies. Brand new technology that came out, I say it's brand new. To everybody else, it's ancient. But the Fitbit came out. Well, they created the Fitbit, and the Fitbit was going to tell you your heart rate. It was going to tell you all this information about you, and they tested it out all on white people. So what happened when they put it on somebody who had darker skin? The wavelength of the light that they were using didn't penetrate, and all of a sudden the watches were coming back saying, hey, your watches don't work. because they never tested it on a larger population to see what would happen. And because of that, Fitbit ended up crashing their first device. Apple took their market share, and when Fitbit came back with their new devices, they already had the stigmatism to a large part of the population that these people don't care about us, they don't care about our product, they don't care that their products doesn't work on us. And Fitbit had a really, really hard time overcoming that in the early years. It's because they didn't include DEI in their testing of their hypothesis, and you have to. So kudos to mentioning that you do need this larger population because, you know, again, I think way back into the years where they tested birth control on men. Are you kidding? Really? Anyway, we'll go on to other things that we can understand. So when you're looking at your, we're going to talk about all those elements that we're going through. So the first thing you want to look at is your market. If you remember that list that I threw up there, the number 2 thing besides cash of why businesses fail is they created something that nobody cared about. It wasn't a need. So you got to go into your market and say, how big is my market? Total cancer, and then get down to breast cancer, and then get down to triple negative breast cancer, and then say, here's the people that can actually take my product that we're going to be in the hospitals. And when I launch my product, here's the little group that I can hit. And I can get this out to them immediately. And we call that the TAM, the SAM, the SOM, and the LAM. Anybody in business school, you probably had to kick that out a number of times. But we look at the market and say, what are we talking about? Are we looking at a market that maybe is $1 million? That's going to be far different than if I'm looking at a market that is $1.5 billion. The totality of what I'm doing here and the effect that I'm going to have on the population. And when you look at effective population, everybody thinks of dollars. And I can tell you that even with my with the MSU Foundation board, when I come up, I can talk about science till I'm blue in the face, and they'll all look at their phones and do everything. But as soon as I start talking about dollar amounts, their heads come up because that's one thing they can understand. So just remember that. You're going to talk about science, they're going to shake their heads and go, oh, that's great. And then I'll make $1 billion. Whoa, hello, this is awesome. We love it. Let's move. So, and you want to think about how quickly can I get to my MVP, which is my not most valuable person, but minimal viable product. What is the smallest thing or closest thing I can make that I can sell versus doing iteration 2, 3, and 4 that might go to larger markets? And then we have to really delve in on the customer. Who is your customer? Who are you selling to? And do they even care about your product? And the other thing that I didn't like, and I saw this a lot when I was at Wayne State University, is that, hey, this Gidget here sells for $150. We can make it for $20. Why don't we make it and we can undersell them? We can sell it for $30 and we'll make this margin. And this is a great strategy going forward and everything else. But then they find out that the manufacturer actually makes this for $2 and they're making $118 profit off of each one. So you really have to delve in and understand that market and the market dynamics. The first thing you got to delve into is your customers. And then what we use in this is the business model canvas. So anybody here go through that certificate program for entrepreneurship that EMU has? No? Okay. Oh, I've got a couple over here. Okay. You guys have probably seen this ad nauseum and heard this ad nauseum, so you guys can play on your phones and finish eating your cheesecake, and that'll take you about 10 minutes, and then we'll get back to you. So, but Business Model Canvas, this is a tool that's been around for a long time and helps you to walk through who are my partners, my activities, what resources do I need to do, what's my value proposition that I'm kicking out there. What are my customers going to want? What are the channels I'm going to reach them through? Things you don't normally think of. You got to map it out here. So we force people to kind of map this out. And as they map it out, they're thinking, oh, I didn't think of that. I could do this. And then you start ideating. And that's what happens when you write stuff down. And how many people have been in the chemistry room when you're sitting there writing your structures and everything else and go, hey, I can make this analog and we'll just add this here. This will be more electronegative than this, so this will work better. And next thing you know, probably about 12 whiteboards later, they say, oh, here's the molecule we need. So those that are not chemists, I'm sorry, I just probably bored the heck out of you. But for the chemists out there all shaking their heads, they all know what I'm talking about. And what are your revenue streams going to be? And the problem is if you run out of money, and I'll have a slide on this in a little bit, the game's over. So with a startup company, you constantly got to think of what are my resources, what can I do, how can I do it, what's my money, and constantly reevaluate that. Competitive analysis. Lord, I hope I'm this VI interest that's out there because then I would be in a good place. But if I'm the one that's out there like Waywire, I'm probably not doing so good. So if there's already somebody out in the market that can do what you're doing or possibly do it better, you're already dead in the water before you start. unless you have something up on your competition. So you have to know who your competitors are in this market and who's working in that. One thing you don't want to get trapped into, and I've heard this many times, and I've actually, to detriment, seen programs close because of it, is, hey, there's a great compound that is in phase 2 clinical trials that's promising. And everybody's seen that. But then it gets to phase 3 and they find out it has toxicity and shuts down that whole program. If it hasn't gone to market yet, you want to keep an eye on it, but you can't consider that a success. And we've had a lot of drugs that have competitors that we kept on going on, that have been in clinical trial with competitors, and those competitors fail, we can still move our product forward. So don't think of that as a killer just because somebody seems like they're making ground. And I had a pastor that once told me, and I got any mathematicians in here? Nobody? Okay. Well, this happens in statistics a lot. A text taken out of context is a pretext for whatever you want. So I can make the statistics look really good until you start delving into it, and all of a sudden you go, oh, they threw 40% of the population out because they were above 55. Well, guess what? We're working with Alzheimer's, so does that really make any sense? Well, no, it doesn't, but it makes the numbers look good. So you got to know what you're doing, and you got to look into it. This is not something that you just gloss over. You really have to dive into what does that competitive landscape look like. So a couple of things. I just love a lot of these quotes. We do something called customer discovery, which is where we go out and we call people and we talk to them about their needs. We don't pitch our product because Henry Ford said, if we go out there and I ask people, what do you want? He's going to say faster horses because the automobile didn't exist. But when he found out that, it takes me 6 hours to get from point A to point B because I've got to stop 4 times to feed my horses, his thought was, well, if I have this automobile, I can go from point A to point B. I won't have to stop it. I can do it in 2. So now he met the need that the customer wants to go faster, but he didn't ask the customer necessarily what they want. And when Steve Jobs came out with the iPhone, which was revolutionary, he came up with this other quote. It's not the customer's job to know what they want, but the customer knows their needs. So if you can find out what their needs are, then you can create something to address that need. You don't want to ask the customer what they want. They probably don't know. They only know what they know. They don't know what you know. So if you can use your knowledge and you can use your ingenuity to create something brand new, you can change that customer's identity. Back when I was younger, I remember when I was in the Army, and this thing called the internet came out, and it actually came out of the Navy. I was in the Army, so yeah, excuse me. But where the ships were talking to each other and this internet came out, and I'm like, what's the internet? Why is that going to be important? And one guy told me, he's like, oh, this is going to revolutionize the world. And I was like, nah. Because it wasn't part of my world, and guess what? You can't go anywhere now without the internet. People even have their watches hooked up to it. They have devices hooked up to it. And, all I have to do to get my kids' attention in my home, I can scream all I want, but if I go and unplug the internet, they all come out and go, Dad! So, but you didn't know what you didn't know back in the day. So don't think that the customer's going to know. Find out their needs, not what they necessarily say that they want. And that's going after it. The other thing is, I love this one, and this probably isn't quoted as much as the others, but Sam Walton said there's only one boss to the customer, and he can fire everybody in the company from the chairman on down simply by spending their money somewhere else. And how many times have you gone to restaurants or anything else where the customer service has been terrible and you said, I'm never coming back here again, and the next thing you know, that restaurant closes down or that business shuts down, because if they spend their money somewhere else, you go out of business. And that also talks about how you have to represent what you're doing and how you have to defend what you're doing, from your research, from your technology, because if you don't defend it and if you don't stand up for it, nobody else will. And then they also created a program at the NSF, and by the way, if anybody wants to go through this, I highly recommend it. It's a free program called the I-Core program. It's by the NSF. They run it out of Western Michigan, University of Michigan, Michigan Tech. Like I said, free to everybody, but you go in and they teach you how to do customer discovery and how to make those calls and talk to people and find out their needs without pitching your product. And we send all of our companies there. Every startup that we have that comes out of MSU goes through the I-Core program. If they want our support, if they want our funding, they go through the I-Core program. And I think probably 40 to 50% of all the companies we send pivot their business plan and their business model based on the customer discovery they get in that program. So anybody who goes, oh, I know what people want, I know where I'm going, I know what I'm doing, I've heard that many times, and then they come back and go, oh yeah, we found this out. I didn't know this, and now this is what we have to do. So again, fantastic program, and it's free of cost to everyone. Oops, I guess I should probably use my clicker. There we go. Intellectual property. I've taught on this many times. If you guys want to pull out your pillows, your sleeping blankets, and everything else and get really comfortable and let that cheesecake really settle in, I can give a talk on this. But intellectual property blocks other people from doing what you're doing. It doesn't enable you, it just stops other people from doing it. And so if you don't protect your intellectual property, let's say I've got a drug or a drug idea, and I go to Pfizer and say, this is going to cure cancer of some kind. This is great. Does Pfizer really care about the drug that I have? Do they care about the research that I've done? The answer really is no. What are they going to care about? They're going to care about the intellectual property that you filed and how it covers them, that if they get your intellectual property, they can go and work in an area where nobody else could work in for a certain amount of time. You know, we won't talk about the 20-year patent life and everything else, but just understand that patents are important, because for that pharma company, they know they might have to pour $1 billion worth of research into that technology to get it to a patient, to get all the way through all the hurdles they got to do, all the regulatory hurdles, everything else. And if they're going to spend that $1 billion, they're going to want a return on it. The good news is, after 20 years from when that patent's filed, it goes free, it's open, it becomes generic, and it becomes cheaper for the whole world. So that's what patents do. And without patents and without copyright, we really can't take technology forward, because then you go to the people with the money and you say, give me $1, and they're going to go, okay, I'll give you $1. How much are you going to give me back? And if the answer is, well, you're going to lose 50 cents, they'll say, well, I'll take my $1 somewhere else, and that technology never gets developed. So patents are very important. So is the patent strategy. And this goes back to planning. If I do my patent now, the problem with a lot of drugs and with a lot of medical devices and diagnostics sometimes is it takes so long to develop. You might not get it through like phase 3 clinical trials or 510K for 15 to 17 years. And then what? You've got 3 years on market to make your money back. And you wonder why drugs cost $120,000 sometimes for treatments. But if I could continue to put new patents on that technology as I evolve it, and I have more time and more of a window to make my money back, that's going to be, your likelihood of taking that to the market is a lot higher. Oops. And then development. This is the part where scientists come in and shine. What do I have to do to get my product from where I'm at now? And let's just say I made this is one that we use all the time, never mind some of the nomenclatures in here, but we look at, you know, where am I at? What do I have to do to get from where I'm at now to where I want to go, and how am I going to fund it? Those are the key questions of development that you're going to have to do. No different than any faculty member out there has looked at their own projects and say, how am I going to work on this? What am I going to do? How am I going to get this to the next level? How am I going to pay my postdoc? How am I going to pay my people? How am I going to take care of my students? So this is nothing new for faculty members. They do this all the time with their own laboratories, but now we just need to look at this also with a business light on it. And how do we move it forward to like investigational new drug? And then we can go into humans, and we can go through and all the way to a new drug approval, and now we can actually get to patients on a large scale, a world scale, and make that difference that we want to make. One of those mechanisms that we do, so people think I can go out and get funding. Funding is hard to get. If anybody's done it in this room, I'm sorry, I apologize up front. I also work, I put on another hat as an investor with 2 of our other companies, Red Cedar Ventures and Michigan Rise, also subsidiaries of the MSU Research Foundation. But if you can't get that money from investors that are out there, you can go for what's called non-dilutive funding, which means they don't take equity, but you can get SBIRs and STTRs, which is government funds, and there's 2 types. There's a grant and there's a contract. The grant means they're doing it and they're giving you the money for the betterment of mankind. The contract means that that industry actually wants your technology when you perfect it. Like the DoD doesn't work very much in grants. They work in contracts because if they're giving you money, they want your technology. They're going to be your first customer. So when we, and this is MSU, so Spartan Innovation supports that. When I came in 2016, as you can see here, MSU supported companies were only getting about $250,000 in grant money per year. That's it. For MSU, who at the time was getting about $400 million in research funding per year. We started a program in 2017 specifically aimed at SBIRs and STTRs, and in 2021 we had over $12 million in this funding. The year after that we had about $10 million. You can see where COVID took its toll. But now we're steadily getting about $10 million for our startup companies in SBIR and STTR research per year. We also got the Tibbetts Award from the SBA, along with the BBC ETC, who's our partner in this, for our excellence in as an organization supporting this grant mechanism. First one in Michigan, by the way, on the organizational side. The other thing that's really important is your team. Every time I have somebody come up and say, I'm starting a company, and they say, well, it's just me and my postdoc. As an example, if it's a faculty member, it's like, well, you need to go out and you need to build your team. Because if I'm looking at it, let's say I'm an investor or I'm a reviewer on a grant, I know that when you're taking that drug to market, you don't just need to have the science side of it. You need to have the science. You got to have a business person. If you're going to clinic, you should have a clinician on your team or a group. Regulatory is a huge issue. And how many times do people think about manufacturing? It's one thing to take bacteria and shake it in a flask in the lab and get a couple micrograms of product. It's another thing to do that on a scale and get kilogram quantities of a drug. And sometimes, yes, even promising drugs fail because they don't have a good manufacturing plan. So you need that person on there. You need an investor. You need legal people to start your company. Are you going to do a C Corp? You're going to do an S Corp? You're going to do an LLC? How are you going to manage that company? Who you're going to have on your board of directors? All these questions. And then the big one is accounting. And if anybody has been in big industry, and we're talking $1 billion and above, anywhere that CEO goes, their CFO typically follows. Because the CEO knows how to manage the company, but he's always talking to the CFO and saying, where's our money? What can I do? What can I not do? Do we have to buckle up? Do we have to hire people? Do we have to fire people? What you typically do in management. So you have to think about all of this. And even though you're a small company just starting, you still have to put your team together like you're a larger company. So pro forma, this is everybody's favorite. My wife is studying accounting. She's going to be an accountant. She loves numbers. I go to people, especially scientists, and say, we're going to sit there and do accounting models, and the first thing they look at is go, me? Okay. Building pro formas. You got to know where your money is going. You got to know where it's at. You got to know where it's going to be, and you have to project. And you're going to have to think of, where am I going to be in 2 years, 3 years, 4 years? The one thing that always turns me off as an investor, and that's when I start looking down and start playing with my phone, is if somebody goes, by year one, we're going to be making $1 million. By year two, we're going to be making $45 million. By year three, we're going to be a $100 million company. Thank you. Are you done yet? That's just pie in the sky. It doesn't happen that way. When you look at somebody and you can tell, did they really go over their numbers? Did they do their homework? I don't care if you're losing money for the first 2 or 3 or 4 years. If all of a sudden you start making lots of money, I'll take that 2 or 3 or 4 years at a loss to make that money on the far side. And I won't get into multipliers and all the stuff investors do, but you've got to be realistic. And if people don't think it's realistic, and you have to remember, I think we look at something around 12 to 18 different investments per month. And we make about 4 or 5 investments per month. So you think about that, that's like 200 investor proposals we look at per year. And if you've got pie in the sky, you don't think I can pick that, you don't think I could pick that out and go, yeah, that goes in the circular bin. This one goes in the square bin. So we can. So don't try and pull the wool over anybody's eyes, because they just won't believe it. And again, this is where I say, if you run out of cash, just like in Monopoly, game's over, you're done. Your business plan. So the compilation of all this stuff goes into your master plan. And one thing I hate hearing from anybody is, I'm going to create a business plan. You need to have a 30 to 50 page document. I want everything detailed out. If somebody gives you that advice, just stand up, say thank you for your time, turn around and walk out. Because in reality, if you create a business plan today, that plan will probably change 3 to 4 to 5 times in the next year. And if it doesn't, I'm going to ask why it hasn't, because you're missing something. A 5 to 10 page business plan is all you need, and expect that it's going to change. And if it doesn't change, why didn't it change? Because it should. Because we never have the right expectations. I thought my son was going to clean his room every day. He's going to do the dishes. He was going to put them where they needed to go. I can tell you that was my disappointment. Actually, it's kind of fun. But it'll disappoint you the same way if you think you can figure everything out right off the bat. So what do we do? So the MSU Foundation, a research foundation, we changed the name about 8 months ago. We have an endowment of about $450 million in the bank. So we sit on a lot of assets that we manage. Most of that goes to, the university's block grants. Some of it goes to our subsidiaries, which I'm one of those. The rest just stay in the endowment. But it was created off of carboplatin and cisplantin that was done for cancer a number of years ago. About 330 million royalties came in, and that's what we survive on. So we don't really fundraise. But what have we been able to do with that? And this is our impact basically since about 2017. Right now we have about 123 active companies. We created about 845 jobs, not just us, but us and our partners. We've deployed almost $20 million worth of funds, and this is, by the way, last month's numbers. And we've got about 68 diverse founders out of the companies that we funded. And the one that I always look at is the co-investment leverage, how much money was added to our money, and we're at about $906 million right now. Non-dilutive, so all those SBIRs and grants and other things we talked about 167 million. Then we have about other people that we've invested with, 495 different agencies, and we've had about 22 exits now. And so our funds have only been going since 2017. Our big fund didn't even get going until 2019. And this is the impact that we had, not only on the stuff coming out of MSU, but we work in ecosystems in the state of Michigan as well. So we've got a group out in Grand Rapids. We're building a group with Henry Ford in Detroit. We're working with people up in 20 Fathoms in Traverse City because we're a land-grant university. So by our edict, we're all across the state. So that's the kind of impact that we can have. And I know that Eastern Michigan at one point was looking at creating a foundation here as well. And hopefully that your guys' groups and the research that's done here will have an impact that can be similar to that. That would be the goal that we would love to see. And to Eastern Michigan's credit, if you don't think that they're heading in that direction, a couple of years ago, had a talk with Dr. Sanjib Chowdhury, and he created a executive certificate in entrepreneurship program, and I guess there's two people over here that have taken advantage of that. But that's exactly what he's teaching here. He's teaching people how to take their technologies, how to take their ideas, how to take their research, and how to move it forward to create these startup companies and move their startup companies forward to success. So that's already happening here at EMU. You guys are already on the road to that. I'd say we have probably a little bit of a head start. We kind of started earlier. University of Michigan started much earlier than we did, and we haven't caught up to them yet. Although they've got about 2 million or twofold times as much research funding as we do. But we've been moving faster on them than they've been getting away from us. But that's the goal, but it's already happening here. So you guys are already being these early groups that are taking technologies, translating these technologies forward, and moving them to the next level. Another thing that I find out too, whenever I talk to a faculty, I can't go to a faculty and say, I want you to leave your tenured faculty position, leave it all behind and come over here and do a startup where you're likely to fail and you're going to take on high risk. They'll just kind of look at me cross-eyed and say, no, thank you. So how do we launch any companies? It's not through the faculty, it's through the students. It's usually a graduate student or postdoc that works with their faculty, starts this company out, gets their faculty to consult for them, maybe as their CSO, and they move the company out. It's the students that do that. So when I throw up that picture or that image of all the success that we're having and all these companies that are moving forward, it's really not the faculty that are doing it. It's their technologies, but the students are the ones driving these companies. That's you guys. So you guys are the ones that are going to be taking the technologies you're working on now, you're going to translate them, you're going to be the business leaders of tomorrow, and you're going to have this transformational change. And one of the programs, I don't talk about it here, but one of the programs we have, we call the Conquer Accelerator, the CADE program, the Conquer Accelerator Diversity and Entrepreneurship Program, where we take already started up companies that are doing well. We pick the best in the state because they come from all over, and we take underrepresented interns and we put them into every company. And people ask, well, why do you do that? Is that just to get them a little exposure to it and to get them doing something? No, it's to seed them in that company so they stay with that company when that company grows up. Because if that company becomes the next Pfizer, if that company becomes the next, you name it, now you're going to have somebody who's underrepresented in that C group, that C-suite at the very top, and they're going to open opportunities for others. And then that's how we culture change. That's how we make a difference. And again, there's people, I guess I call myself kind of a consultant that do that, but I don't do the work. I just consult with people and say, here's what we've done, here's what we do. You guys are the ones that actually take this forward. So I really thank you for your time and appreciate that. If anybody has any questions, I'll be around, let me know. But it's been truly great to be here after all these years and be able to talk to you guys. Thank you.